Okay, so we are day 3 of Women's Health Week, and the topic is menopause and perimenopause. And we're very lucky to be joined by Dr Emma Rees today, who is the CEO of Femma, a clinically based digital healthcare service. She's also a women's health GP specialist with over 20 years' experience in the UK and Australia. And she's got a background in clinical research and shared decision making, medical teaching and occupational health. So very qualified to speak to us today about menopause and perimenopause. So just briefly, Dr. Emma, if you could tell us what is menopause and perimenopause and what's the difference there?
So menopause is diagnosed 12 months after your last period, be that a natural period or if you've had a period for surgical, or if you stopped having your periods for surgical reasons. So for some women, they'll have chemotherapy, or they might have their ovaries removed and will stop their periods then. And that we would call a surgical menopause. But for many women, they will be diagnosed with menopause 12 months after their last natural period. And that's when we can formally make the diagnosis. But for the 8 to 12 years running up to that time, we are probably all in perimenopause. 12 years is probably the longest period of time. But on average, it will be around about 6 to 8 years for many women. And perimenopause is the time when our hormones are really probably wildly fluctuating, and we are most likely to start experiencing symptoms. And there's about 34 symptoms that are related to the perimenopause phase. So lots and lots of things that can happen. And I think the really important thing around that is that often, because these symptoms can be explained by lots of other reasons. So poor sleep, for example, we might be busy, or we might be feeling under stress for work or family reasons. We often explain the symptoms away for other reasons, and we might have periods of time where we're having lots of symptoms and periods of time where we're having hardly any symptoms. And so many women go through that phase really quite under-supported, because it's not recognised that what's happening is that their hormones are fluctuating and they're in perimenopause. And so I think as clinicians, it's really, really important, and for women ourselves, it's really important that we think about menopause and we think about exploring those symptoms and not necessarily just explaining them away. And the other really important point is that for some populations of women, they will start menopause on average earlier than Caucasian women. So Caucasian women, it's at the age of 51, but Aboriginal and Torres Strait Islander women and Black populations will go into menopause 5 years earlier on average. So it's worth thinking about.
Yeah, that's interesting. So what are kind of the signs that you would expect when you were entering perimenopause? Is there a certain age, or are there sometimes signs that you see?
Yeah, so I think firstly, the most common symptom that people will experience is hot flushes or hot flashes. We describe it both ways. 85% of women will experience that, and it may manifest itself as the classic kind of hot flush, and people feel that this hot kind of wave rises up their body, and it can go on for seconds, it can go on for minutes, and it can happen really unpredictably. But it can also manifest itself as cold shivers. So that's another thing that often isn't spoken about, but it can manifest itself either way, because the problem is around thermoregulation, so temperature regulation. And so vasomotor symptoms, as we describe them, can either be cold or hot. And the other one is night sweat that some women will experience. So waking up at night completely feeling drenched, and that's another really common symptom. Some of the symptoms that we probably don't talk about as much are things like losing libido. That can be something which we experience as we go through menopausal transition. And that's because your ovaries also produce testosterone. So it's another hormone, but that hormone is really, really linked to our sex drive. So if we lose levels of testosterone, then we can see libido does decrease. So that's another symptom that we probably don't talk about as much. Other things, joint aches and pains, skin getting drier or starting to wrinkle a bit more readily, dry hair, because estrogen is a really, really important hormone, and it's really one of the building blocks of the female body. And it's linked with what happens in our cells in terms of collagen. So when we start to lose estrogen, we start to lose collagen, and that's why we start to experience things like joint aches and pains and dry skin, dry hair. And for some women, they'll also notice that they start to have problems with their pelvic floor a bit more readily as well. So lots and lots of things, unfortunately.
Yes. And yeah, the hot flushes, I suppose, is something that you hear of all the time. Is there anything that you can do to prevent or at least to lessen the effects of hot flushes?
Yeah, so there are lifestyle things that we can do, and there are medications that we can use. So if we think about lifestyle, first of all, a really important one that we probably, again, don't talk about as much as we should is trying to think about how we dress, for example. So layering clothes so that if we are experiencing hot flushes, it's easier to accommodate that and manage that. There is some evidence to show that certain forms of yoga can be helpful for hot flushes. So it's something, and again, with some of the mental health side effects of menopause, yoga and meditation can be really, really useful. So it is something worth exploring. There's a lot of attention on diet and what we can do in terms of diet, and some research going into phytoestrogens. So phytoestrogens are found in things like soy in our diets, and I think partly because women from Southeast Asia report hot flushes less frequently than their Western women counterparts. There's a lot of attention on perhaps the role of soy and phytoestrogens in the diet and whether or not that makes a difference to hot flushes, but there's no clear, conclusive research around that. It's still an area that people are exploring. The only real supplement that has been shown to be useful so far is black cohosh. So some women will use supplements that contain black cohosh and can help and make a difference. Although if you are using supplements, it's worth, if you're on any other prescriptions, making the pharmacist or your doctor aware of that so that they can make sure there's no interactions. And then there's medications that a doctor would prescribe. So there's, in terms of the hot flushes side of things, the most effective treatment is hormonal replacement therapy. So and if you're eligible for hormonal replacement therapy and you are suffering or experiencing symptoms, it's worth exploring that. If you're not eligible for hormonal replacement therapy or menopausal hormone therapy, then and that's generally because of breast cancer, then one of the options that will be considered or could be considered is SSRIs, or a form of medication that's quite commonly or most readily used in depression and anxiety. But there is evidence to show that those medications can also make a difference to hot flushes. So for menopausal therapies, we will use them for women who don't have anxiety or depression because they can make a difference for those hot flushes.
Right, okay, yes. I was going to ask you about the hormone replacement therapy because I know that it was in the news. It feels like quite a few years ago, but it was quite controversial and it seemed like he was sort of really jumping off that bandwagon. But obviously now, it's, as long as it's closely monitored with your doctor, and there seems like there's a few therapies now that, and a few avenues, even natural therapies, where you can get some help and some support for alleviating those symptoms. So can you tell me a bit about your online platform, Femma, and how you could potentially help with menopause?
Yeah, absolutely. So Femma is a service developed for women, and it utilises the skills of women's health GP specialists. And so for anybody who, for example, is wondering if they're going through or experiencing perimenopausal symptoms or menopause, there is an opportunity for them to go online, and a lot of information and articles available on the website, but they can also connect and do a consultation with a doctor around menopausal symptoms and have a resolution in terms of treatment options. And those treatment options can include medications, but they will also include other lifestyle options, and could just be lifestyle options alone. It depends on the preference of the individual as to what they want to explore and how they want to approach it. And then through the platform, women can also connect with on-demand nutrition and fitness and options to help, lifestyle options to help manage their symptoms, as well as have prescriptions. They receive a QR code to get prescriptions from their chemist as well.
Wow, fantastic. So how do women sign up for Femma?
So people can sign up for free. If they go on femma.com.au, then you can sign up for free. There's a box in the middle of the page, and you can do that, create an account, and then you can explore the website. If you want to have a consultation, then you can start the consultation and go through the consultation form, which is quite extensive. It takes between about 10 minutes to complete it, but it is very extensive and asks a lot of questions. So it really is, it emulates what you would be asked if you saw a GP face to face. And then at the end of the form, you can submit it, and then you can book an appointment with one of our GP specialists, which is a video consultation, and they will sit down with you, go through the form, go through what you want to do and how you feel and what your other clinical considerations are, and then create a treatment plan with you. And you can then see that treatment plan in your account afterwards.
Brilliant. That sounds like a great option, because I know so many women sort of don't feel like, they think this is a normal stage of life and hold off maybe seeing a GP and put up with some symptoms that are pretty severe and debilitating to their lifestyles. So it's great that there's a platform there where it's specialised and obviously knowledgeable doctors that know a lot about how you sort of manage and the different options. Fantastic.
The other thing that's worth saying is we have a community forum on there, which is free to use, and women can put on questions, general questions that can be answered then by one of our experts, and also other people in the community can comment and join in that conversation. And I think we really want to try and overcome that sense of isolation, that you're going through this alone or that your symptoms aren't valid, because I think that's one of the main really hard things to navigate for people when they're going through experiences like menopause and perimenopause. Nobody talked about it before. Nobody really, it's hard to find out, even as a women's health doctor with an interest in this, I can't find out from my own mum what her experience was. And I think that's traditionally always been the case. So in trying to overcome that sense of isolation, I think is really, really crucial.
Yeah. And I think there's almost a little bit, the tide is turning a little bit and women are reclaiming that. It's a rite of passage almost. And people are sort of celebrating it and talking about it a little bit more. For me, I think of it like similar to, when you give birth and you become a mother, and there's so much change that you go through, and reaching out and speaking with your community and peers and other mums, it's so helpful. So I'm sure at this stage of life, it would also be extremely helpful to be in touch with your community and your village and your support.
Yeah, absolutely. And the expertise that's within that, both from people who work in the women's health space, but from people who live as women and, experience it themselves. I think it's really, really great to be able to bring all that knowledge together.
Yep. Yeah, brilliant. Okay, awesome. Thank you so much for your time today. We'll let you get back to whatever you're doing in Ireland, speaking Femma, getting more people on the platform. Thank you so much for your time. We really appreciate it, and telling us all about menopause.
You're very welcome, and thank you for speaking to me today.